Offbeat with Dr. Benita Zahn.
You know the old saying, you are what you eat? Well, a new partnership is expanding that. What you eat can keep you healthy. Kathy Leyden is with CDPHP, and she's going to explain about this first of its kind consortium between CDPHP, Healthy Alliance IPA, and the food pantries of the Capital Region. Hi, Kathy. Good to have you with us.
Good morning. Thanks for having me.
And since we're doing a sort of mixed media when it comes to our technology to get you, I mispronounced your name. I want to apologize. It's Kathy Leyden, and you are the Director of Community Engagement for CDPHP, which is perfect because that's the whole point of this project, this consortium, is to get the community involved, to better understand that what you eat helps you how you feel.
Absolutely. And we know that food insecurity is a significant issue in the Capital Region. It's estimated that over 80,000 local residents are considered food insecure, which is basically 10% of your fellow community members and neighbors.
When you say food insecure, what does that mean in terms of this food insecure?
Sure. So a lot of times when people hear the term food insecurity, they think of hunger, not having enough access to food. That's obviously a significant part of the issue. But the other side is not having enough access to food that includes healthy options, like fresh produce, for example.
So there are some folks who live in what we call a food desert. You've
Correct.
got the bodega on the corner, a package store perhaps, and that's about it, and the supplies are limited. So you're trying to, what, get people, how to get that access to this food if it's not already there? How are you planning to do that?
Right. So we designed a program, and the model includes a menu of different service options for any of our CDPHP Medicaid members with identified food insecurity needs. We work through a network of local pantries to provide these services, and they range from food pantry packages that include extra items like fresh produce, lean protein, whole grain items, dairy, eggs, things that typical food pantries aren't always able to provide. And so those packages are ideal for someone that's looking to make healthier lifestyle changes. We also have another level of service that provides medically tailored food packages for people living with diabetes and hypertension with oversight from registered
let me
dietitians.
jump in. What does a medically tailored package look like?
Sure. So yeah, it would contain exactly the right items that someone who is trying to better manage their hypertension or diabetes would need. So whether it's low salt foods, where the sugar content is managed. And again, all of that is overseen by a registered dietitian.
Now, Kathy, for some people, it's difficult for them to prepare their food. Will there be any support in that area as well with this program?
Yes, there's a huge emphasis on education with this program. So the members participating in the program will receive a lot of education and support around food preparation, also with a goal of building healthier food shopping habits, being able to pick out healthier food items in the future, making sure that folks are enrolled in SNAP benefits so that they can utilize those in the future to purchase healthier foods. And then we also have a service level that provides home-delivered, healthy, prepared meals for people that are unable to temporarily cook their own meals at home.
Is there a fee for these meals that would be prepared and delivered? Is there a fee for any of this?
No, it's fully covered for our CDPHP Medicaid members.
And how many members are we talking about?
So we won't know until after the first year of this program. We're excited to see what the uptake is on these services. And I'd be able to check back in with you in about a year to see how many we're able to serve.
Is this based on a program done anywhere else in the area, in the state, in the country?
Not in particular. I think there's similar options out there, but we really thought long and hard with our partners on this initiative about what are the local solutions needed for our local communities? What are the issues that people are struggling with? And we actually had a member reach out to us on social media voicing her concerns and looking for help with how to have more access to healthy foods. And if I could just read for you what her message was, because I feel like it's really telling. So she wrote, "I cannot afford fresh veggies and fruit. I am swollen most nights and mornings from high salt and white starchy foods. I'm working full time, however, just barely paying my bills. I only get $48 in food stamps monthly, and I'm desperately searching for fresh food. I don't feel good after I eat what I can afford. And so we really kept that member's issue, her story, with us in mind when we built out this program. We wanted to build a solution that would work for her.
You know, Kathy, some would say, well, this is going to be costly for you, for the Healthy Alliance IPA, for the food pantries. Bottom line, though, after the initial expense, I'm imagining you expect to see a savings in terms of healthcare provided to this community.
Absolutely. Yep. The long-term goal of this initiative is to see a reduction in cost of care for members in the program. When you look at the level of service that's geared at folks who are just getting home from the hospital and need that home delivered prepared meal, we hope that an intervention like this could help even reduce the readmission rate for those members.
Well, I don't mean to throw down the gauntlet, you know, to other insurers, but it'll be interesting to see what results you do have and then how others follow suit, the consortiums that may pop up. And if anybody's looking for information, any of your members, just go to the CDPHP website.
Yes, or they could also call our care team hotline at 1-888-94-CDPHP.
All right, we'll set up a link to your website as well. Kathy Leyden with CDPHP. Sounds fascinating. You got to keep me posted, see how well this is doing and how your members are faring.
Absolutely. Thank you, Benita.
Thank you. Thanks so much for joining us for this edition of HealthBeat. You can always go to the CDPHP website for more information, and we'll see you next time.